The thoracic cage is a bony structure that is also known as the bony thorax. Its elements include the thoracic vertebra, which are located on the posterior side, the ribs, which are located on the lateral aspects of the thoracic cage, and finally the sternum and the costal cartilages are located anteriorly. The costal cartilages are bars of hyaline cartilage that secure the ribs to the sternum. The cage functions to protect the heart as well as the great vessels that emerge from the heart. That includes the large arteries like the aorta and the large veins, the vena cava. The thoracic cage also protects the lungs. It functions to support the pectoral girdles, which we'll see in just a moment in the next lecture segment. And finally, the bones of the thoracic cage, particularly the bones located on the superior part of it, provide attachment points for muscles that manipulate the movements of the head and the neck. So the sternum is a bone that composes the anterior side of the thoracic cage. Its shape vaguely resembles a necktie, which is very appropriate because of its location at the base of the neck, which is where a necktie is worn. It is a flat bone because it is flattened in the anterior or posterior direction, and it's approximately 6 inches in length. There are 3 regions to the sternum. The manubrium makes up the superior region of the sternum, which resembles the knot in a necktie. The manubrium functions to support the clavicles of the pectoral girdles, and it also articulates with 2 of the pairs of ribs. The body forms the bulk of the sternum, and most of the ribs that attach to the sternum will attach to various places along the length of the body of the sternum. It has small notches for the costal cartilages of the ribs that do attach to it. And finally, we have the xiphoid process, which forms the inferior end of the sternum. Its name means sword-like process because its shape resembles the blade on an ancient sword. It is typically made of hyaline cartilage when we are young, but tends to become fully ossified, that is, converted into bone tissue, by the time we are approximately age 40. It serves as an attachment point for a few of the abdominal muscles. There's a few important landmarks on the surface of the sternum. The first is the jugular notch, which is a U-shaped indentation that's felt at the anterior base of the neck. So if you locate the space directly between your 2 clavicles, the indentation that you find between them is the jugular notch. It's an important anatomical landmark because it marks the location where the left common carotid artery branches off of the aorta being the largest artery in the body. The second landmark is the sternal angle, and it's felt as a horizontal ridge across the front of the sternum, where the manubrium of the sternum joins the body. It's a cartilage joint that functions much like a hinge, and so it allows the body of the sternum to swing forward when we inhale. The thoracic cage has 12 pairs of ribs that flare out from the sides of the thorax and form the lateral walls of the thoracic cage. All of the ribs are attached on the posterior side of the thoracic cage to the thoracic vertebra. They curve anteriorly and inferiorly towards the front side of the body. The 7 superior pairs of ribs attach directly to the sternum by individual pieces or individual bars of costal cartilage. These ribs are called the true ribs. The remaining 5 pairs are called false ribs because they either attach indirectly to the sternum or they have no attachment to the sternum, which is the case for rib pairs 11 and 12. So don't let the name confuse you here. These false ribs are in fact ribs. It's just that the term false describes the fact that they are not directly attached to the sternum, or in the case of rib pairs 11 and 12, they are not attached at all to the sternum.